Welcome to the VetMed Wellness and Leadership Podcast, where we discuss central challenges VetMed leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the VetMed profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. All right. Hey, everybody. Crystal Stokes here, and joining me today is fellow Wolfpack graduate, Dr. Katie Cutter. She received her DVM at NC State, followed by an internship in small animal medicine and surgery and an ophthalmology residency at Cornell University. She is the CEO and founder of Booster Pet, an employee-empowered community that provides accessible wellness for pets in the Seattle area through full-service, in-clinic telemedicine, and urgent care at their 5 locations. And so today we are going to talk all about Booster Pet, how she came up with this unique model, and the wellness benefits it offers to VetMed staff, as well as clients and patients. But Dr. Katie, thanks for being on with us today.
Thanks for having me. I'm excited.
Me too. So, Dr. Katie, I'd love to hear more of your background and your origin story that sort of led you to this idea of Booster Pet. And I'll kind of throw in there, oftentimes on this podcast, we talk about the full circle story where people enter into vet med with a lot of passion, a lot of drive, and then through difficulties and hardships, you might slide down to the bottom of that circle where we struggle a bit and face some real difficult realities of the industry and somehow hopefully find our way back up to the top, working our way back up to that level of passion and drive and love of being in the industry. So I'd really be curious about your story and how that relates to Booster Pet.
Yeah, for sure. So, I became a veterinarian because I always knew from the age of 6 that I wanted to be a veterinarian. And so I think that's a pretty common thread in our community, whether you're a vet tech or a veterinarian. That's something that you knew you wanted to do as a kid. And you always envisioned how your life was going to look because you've had this passion and this drive to get to this place for so long. And then when you're actually then doing the practice, you get your degree, you go out and conquer the world of vet med. And then you realize that, the reality of what happens and the stresses that are involved in clinical medicine, it doesn't always align with what you thought your life was going to be. And that's just not veterinary medicine. I think that's life in general. Where you have an idea of what something is going to be. We work hard towards it. And sometimes the reality doesn't line up with our expectation of what we thought. With that, all that being said, veterinary medicine is a beautiful field. And we have some of the brightest, most passionate, talented people in there. And it's also a field that's gone through a lot of change in the past several decades. And I think it's in a struggle in our industry where we really need to take a step back and say, how are we going to build sustainable systems that support these awesome, passionate, lovely people that work in the field? And so that's the idea of Booster Pet. We've all been through those crazy long hours where, especially as a female here, you're trying to, raise your family, work full time, and just all the bits. There's not enough hours in the day. And then just the stress of the hospital environment. Most clinic environments are very, very stressful. Your staff is stressed. You're kind of wearing 20 million different hats when you're in the clinic, juggling all these responsibilities. And so coming out kind of that space and saying, gotta be a better way. Like we're really bright, smart, passionate people. We can do better. We can do better than having the average lifespan of a vet tech be 5 years, right? We don't have to have the highest suicide rate or one of the highest suicide rates of any industry. We can do better for ourselves and for the industry, and that's what led to the journey of Booster Pet.
Oh, I so resonate with the story, and think so many people listening will also we want to be able to have both. We want to be able to have our own wellness and quality of life while also doing work that we love and taking care of clients and patients. So it's I think it's inspirational when I meet a lot of people who are kind of near the bottom of that circle and they're struggling and they're trying to come up with an idea of like, what do I do next? And to know that there are pathways forward. And sometimes these frustrations can generate some really fabulous ideas. So can you lead us through the journey of how you were first coming up with Booster Pet? I imagine that what Booster Pet is now looks different than how it originally started. I'd love to know more about the beginning. Yeah.
Yeah, no. I mean, it was basically just, kind of sitting down and noodling and saying like, hey, what are our biggest pain points, or what are some of our biggest pain points in veterinary medicine? And certainly we have a staffing crisis, right? So how do we leverage both our technicians and our veterinarians more efficiently, so that we can see the increasing demand of the caseload that's out there, and at the same time try to reel in some sanity back into the clinic so that we can have that work-life balance. I mean, it's kind of I hate that term, but
because a better one now.
Right. But that we need to create sustainable systems, right, moving forward. And so really it was just noodling on how can we do that? And so the idea was that, what are the cases that are in the hospital that we can, elevate that licensed veterinary technician to kind of that role of that nurse practitioner, physician's assistant kind of role in the hospital effectively, and free up our in-clinic veterinarians to then see the non-wellness cases that are in there. So that was kind of how this idea of this in-clinic telemedicine started. We can go from there.
All right, that's my curiosity is piqued. I was thinking back, as a technician, I remember I was always eager for more responsibility and like, oh, can I learn that? Can I participate more? And I hear that a lot from the technicians that I work with. So I think that sounds like a nice opportunity to be able to grow in that career and have a longer, like you said, a 5-year lifespan within the industry is just silly. And that could be a nice step in order to have people feel like there's a real path forward that allows them to grow in their career. So yeah, keep going. What happened next? So there's the idea of it.
Yeah. So it's like, how do we put all these pieces together? And so really, one of the struggles that technicians have with staying in the space is just making a living wage, right? So a lot of times, I think there's two main reasons why they leave the field. One is burnout and feeling underappreciated and underutilized in the clinic, and then two is I'm being, worked to the bone and not even getting paid. Like the Starbucks barista is making more than me, kind of thing. So how are we going to address that? And so we need to put the technicians into some kind of revenue generating capacity, so that then we can, the financials of the clinic sort out so that we can then pay them more. So, technicians need to be making a living wage, no matter where they work. So that was criteria one. The second criteria is, how are we going to free up our veterinarians to see more of the sick cases, surgical procedures, those kinds of things. And free up the capacity of those wellness cases to kind of shift where their responsibility lies in the schedule. And so that's where we started noodling on, well, what if we used in-clinic telemedicine? So this is where we can leverage a veterinarian over multiple hospitals. Right now we have 5 hospitals in the Booster Pet ecosystem. And we have one wellness veterinarian that basically sees all the wellness cases for those 5 hospitals, with the boots on ground LVTVA team in the clinic being the primary care kind of person for those, with the assistance of the veterinarian when we zoom them into the exam room. All the clinics also have in-clinic veterinarians that are boots on ground there as well. So we use a combination of the kind of the telemedicine and the boots on ground veterinarian to complete those exams in a more efficient manner than your conventional GP practice.
That's really interesting. I can see how perspective, it'd be nice to have that flexibility. If you get to say, well, I'd really like to be on the telemedicine side for now, that with the way my lifestyle is and the other priorities I'm juggling, this would be perfect. And then if you want the opportunity to be in clinic, rotating in and being like, okay, I'm the boots on the ground person for this period of time. Nice opportunities to mix it up.
Yeah. I mean, it's funny. Like, as soon as veterinarians see the practice of in-clinic telemedicine, we have a wait list of people that want that job. They're like, that is awesome. Right. And we feel that in-clinic telemedicine, it allows that veterinarian a lot more flexibility in how they can practice, but we're not limiting their practice because they have, the patient, the owner, their whole staff is in the hospital. And they also have another boots on ground veterinarian practicing in the hospital right there. So it's not, people hear telemedicine and they think this at home experience with the client and limited diagnostics. That's not at all what in-clinic telemedicine can do. In-clinic telemedicine, you still have the full range of diagnostics available to you to support that patient. We're just leveraging things in a little bit of a different capacity. Right. So it provides a much more fulfilling experience, I think, than conventional telemedicine or telehealth for the clients, for the veterinarians, and for the staff.
Yeah, you are really solving so many of the challenges. Did you find that your journey through COVID, did this inform much of your current approach? Like, were there things that you adapted along the way just out of sheer necessity during COVID?
Yeah, I actually started noodling on the idea before COVID. And then once COVID hit, we were like, wow, this is a really interesting time here. And I think what COVID did was it also, people started using telemedicine for themselves as a necessity, right? So people got really used to the idea of telemedicine and saw how effective it can be for their own families and for themselves. And so I think what COVID did was really help us in that now when clients, show up and their wellness doctor is, they show up to the clinic, but the wellness doctor is virtual for their conversations. Like it doesn't seem like a foreign concept to them, right? Because they've all done it themselves, right? So there's a buy-in that's readily available post-COVID. I don't know if it would have been there pre-COVID.
Oh, I know it's so neat how our perception can change. It's something before was completely, no, I'd never do telemedicine. Now I love telemedicine. It's so convenient and easy. So all right, I'm trying to walk people through it then. If I was a client coming with my cat, I would come into the clinic, just like I would do with any other clinic. And then we have a whole group of licensed technicians and technical assistants and all the diagnostic that we have in a normal veterinary hospital. So my cat is being seen, let's say, for a wellness check. So she's getting her various vaccines and blood work done and yada, yada. And then at some point during the examination, I have the doctor coming in on an iPad or something like that. So
we have big screens in all of the exam rooms. Yeah. So there's like these big screen TVs. Then, we position them. So, when you're sitting down, it's almost like the doctor's just standing right there and
have it work.
Mm-hmm. Exactly. Yeah. And the veterinarian can see into the exam room. And then the clients can see the veterinarian readily. And we leverage technology. So we have these little spider cameras. So the veterinarian's like, hey, can you get me a closer view of that, the skin lesion or of the tartar that you're commenting on in the teeth or something like that. We can do that. Video, photo capture. We use Bluetooth stethoscopes that record the heart and lung sounds. So the doctors can log on to a database and actually listen to the patient's heart and lungs. It also does an EKG recording too with that. But so it's just it's with all the technology that we have available, it makes for a very complete, a very thorough exam.
I would be so comfortable with that with my cats. Absolutely. I think technology is amazing. And what happens if I come in, let's say it's not a wellness exam, there's something going on, my cat's not eating or drinking, has diarrhea, then what's the path forward in your clinic then?
Right. So, and this is something that happens, and that's, you said, what has been your journey with Booster Pet? So we started as all wellness clinics, mainly so we could hash out the actual just infrastructure of the model. Like, what is the hardware we need? What is this? Does this even work? Kind of thing. And that was super, super successful. It was always our intent to go back and then add it with non-wellness services. And we did that fairly quickly. One of the reasons being that, people don't always realize that there is something going wrong with their pet. So they sign up for a wellness exam. And then our technicians can quickly sort out like I'm seeing things either based on the history that I'm gathering or the physical exam that I'm doing that this really doesn't fall into wellness. Every now and then you have owners that, they couldn't get into somewhere like they kind of like sneak their way in. But for the most part, they're just naive to their pet's health. And so with that, then that's where having the partnership with the urgent care and the boots on ground veterinarian there, they just get transferred over to the urgent care side of the house.
Great. So that's where you had the actual doctor that's actually physically in the building, the urgent care case.
Right.
No.
Right.
Deal.
Right.
This is great. So I'd love to speak more to the wellness benefits, since that's the main focus of the podcast that I host, is on the wellness of veterinary professionals. But also I'm just thinking benefits also, for the patients and clients. This is a very unique and innovative approach, like kind of marrying together different technology and telemedicine. So let's start with benefits that you see for your veterinary staff.
Yeah. I mean, I think I'll start with the techs because our techs are brilliant. We have super skilled, capable techs. We do pay obviously a lot higher than certainly than the industry average, but even the kind of geographic average, and so we're able to attract very talented, skilled technicians and who have felt the pain of being underpaid and undervalued in the clinic for a long time. So they come to Booster Pet, and it's a completely different experience. Like, where you're now part of the team in a very real way. And so we pay you for that, but we also value your opinion and your feedback, and we turn to you as part of the decision-making part of the team. So our techs are I think it's just grateful to be in a position where their skills are being leveraged every single day. And their feedback is critical to the model. Like we rely on the team. My take is that, I've got this idea going, right? But it's the boots on ground teams that actually turn it into reality and make it better and better and better every day. So our teams are always tasked with finding new problems so we can be, constantly improving ourselves, that we're never sitting back on our laurels and being like, oh, we're done. We've got it. We always want to be working on something new, but that really is the boots on ground team coming together and being able to present what's working and what's not working. And then our staff all being very respectful of that and saying, okay, how are we going to accomplish, tackling this problem? So I will say, like, our technicians are amazing, and I think they feel very respected and appreciated. Our veterinarians are fantastic as well. So you have to hire veterinarians that respect technicians. Like that's one. So they're most veterinarians, they can come in and they're just like, oh my God, I've never been in a clinic where I can just say like, this needs to happen, and they turn around and everything's all set up for them. Right? That's like crazy, which is how things should be leveraged in every clinic, right? But there's a lot of reasons why it doesn't happen that way in a lot of places. So our veterinarians are very grateful for the skilled staff that they have. They're also grateful that when they come in, they can focus on a single lane of care. So, if I'm the boots on ground veterinarian in a clinic that day, I'm just focused on those non-well cases, right? And I'm not having to juggle the puppy exams and the surgeries and my focus is very linear. And so that helps you be super efficient with your cases. You're not expected to to wear the 40,000 different hats in the clinic. We want you to come in and do one job, and we want you to do it really well. And we're also going to give you the support staff to do it well. And we've all been through not having those pieces in place. And that's a lot of what leads to the internal stress of working in a veterinary hospital.
Oh, it's the whole model is very anti-burnout, because so many of the aspects we look at what drives burnout, like feeling that we don't have the power to make the changes we need to change. So here you are, you're empowering technicians to really take a more active role, like juggling too many tasks, feeling overwhelmed, not having the resources to really accomplish the necessary job in the given amount of time. So leveraging the support staff more really helps with that. Pathways forward for advancement, getting paid living wages. There are a lot of benefits to your model. I'm wondering when in the hiring process, when you bring on a new technician, do you have to go through a particular type of onboarding training to get them leveled up to the degree? Or are you able to find people who are already at that level?
Our goal is always to find people who have the skill sets that are already there. So we don't consider ourselves a training program, right? So we're not for every technician, because what we are expecting of our technician does require an experienced, seasoned technician. As we grow, maybe we can integrate a training program into that. With that being said, our onboarding process is a lot longer than other clinics, and it's because we're putting technicians into a new role that they haven't done previously, and so that can take an adjustment period. And we want to make sure that our technicians are really solid on kind of the skills and also the format that we do. We are very systematized in how we do things, especially on the wellness side of the house. And so we very much believe in doing that initial investment into our staff, and having, our onboarding process is usually 4 to 6 weeks, depending on the technician, where you're kind of assigned to another LVT buddy, and you're just going through how to do these wellness exams day after day after day, until we feel like you're okay. Now you've got it, and the training wheels can come off, and you're ready to go. But we aren't a training facility. We are certainly dedicated to our staff and believe in continuous training throughout the career of both our veterinarians, our VAs, and our LVTs, right? But we're certainly not looking to have a green tech with a not very easy that come into our system, right? Yeah, that wouldn't be fair, right?
Yeah, definitely get it. And when you so you have this onboarding process, it's nice. It sounds like it's thorough. They still come in, they're already at a high level of proficiency. It's just learning the model and how you guys operate.
Right.
Do you have an ideal tech to doctor ratio that you feel works really well for your model?
Yeah, I would say, our wellness doctor always has an LB TVA team at each clinic that's seeing that. So, the wellness doctor. So if they're, right now overseeing 5 clinics, so they have, on any given day, they have 5 LBTs and 5 VAs to see that caseload that they're seeing. And then our urgent care doctors, it's usually 2 LVTs and a VA. So it's usually like 3 support staff for one doctor on the urgent care side, and then 2 support staff on the wellness side.
Very cool. All right, great. How about let's talk more about the wellness benefits that you see then for your patients and or clients.
Yeah, I think clients, it's been great over the past 2 years to see the clients really embrace the model. And I think, like we had alluded to before, COVID certainly, I think, was a blessing there, because they've experienced telemedicine themselves. So it's not a novel concept in general. It's novel in veterinary medicine that they're coming in here and they're getting this experience that didn't exist before, but it's very relatable to them. So they're very appreciative for I think, for that kind of access to care, and that our visits are efficient. Our LVT, VA teams, they really embrace the client relationship. And so I think a lot of times they get almost a more complete experience. You're not just a number trying to get through. Like, our appointment times, our wellness appointment times are 30 to 60 minutes, just depending on on the case. And so it's a lot of time to get a lot of individual attention from that tech and that VA team. So I think that's a slightly different experience for them too. So the clients have absolutely loved it.
Yeah, I'll piggyback off of that and say, again, I put myself in the position of a pet parent and remembering some of the struggles with just even getting into a clinic. And I think your model allows for more efficiency so that there aren't as long of wait times, like 6 weeks versus 1 week versus a few days. And then also, as a busy working individual, it's really frustrating if you come into a clinic and you have your time scheduled at 11 and you don't get in until noon, because you know how it is, a domino effect. When things get behind, do they get behind? Like they snowball. And it seems like your model is like can help eliminate or at least minimize some of those challenges.
Right. So you just take the lanes of care. I love that you just said that. So you just take the lanes of care of a vet clinic and you kind of segregate them out. And so we're going to take these lanes of care, and instead of like everyone doing everything all the time, we're going to segregate it out a little bit. And so that has a lot of efficiencies for the pet parent, because those wellness appointments are the ones that can book out the longest. Like the urgent care, the sick visits, like they just happen, right? And they're like, either same day or a couple of days, heads up. And so what happens is when you have this backlog of cases from these wellness that can, they can start taking up the appointment times because they can wait, is then you have kind of this distribution of cases where the wellness portion starts taking up a disproportionate amount of time in the schedule. And so you don't have in your schedule time necessarily to see those non-wellness cases. And so when they call, because of course they're going to call, they're still there. All of a sudden your schedule's kind of clogged up with these other types of cases that, that isn't the most efficient use of the boots on ground veterinarian's time. Right. So then everyone starts to suffer because there's not a mechanism that these wellness cases can be efficiently seen in a different capacity. Right. And so that's exactly what happens. Well, you get the sick patients in and you try to fit them in where you can. The wellness cases end up waiting, right? They get triaged, basically, is what happens. And then everyone ends up scrambled, dissatisfied experience. And it's predictable. That's the one that gets, we can see this, it's going to happen. So start setting up structures that you can deal with these situations that are 100% predictable, right?
I was just having a conversation. I think it was Friday. I remember I was in my car, I was driving, it was the end of my day, and I was chatting with a fellow friend of mine, a veterinarian she's just very innovative. She's always thinking of ways to shake up things in the industry. And she was talking about she's really motivated to get more veterinarians into leadership positions. And what you just described is a perfect argument for why that's a good thing. So running a company, having people who've experienced these inefficiencies, they can say, I can see why these things happen. Here's the domino effect. It starts here and then 15 other things happen. And by living it and being that person, boots on the ground, that has gone through it week after week, month after month, I think are best informed to create solutions that are really going to work. Because sometimes, we can come in as an outsider, maybe a great corporate background, and we have a lot of ideas about efficiency, but how to actually operationalize that when you're working with relationships and patients and clients and feelings and expectations and old traditional models and ways of doing it, and being able to introduce something new and in a way that someone who has experience of working in the profession, I think it just has a higher chance of being successful with getting the buy-in of technicians and doctors to implement it.
Right. Yeah, no, I totally agree. I think that there's a balance there, and the executive team, this is the support team, like their role is to support the clinics, right? And so it's interesting. I just had to do an org chart for a presentation, and I had it. So it was like the inverted triangle where like the CEO was like down here. They're like, that's so interesting. And I'm like, but that's our job, right? Like so you're like the CEO, like your job is to support everyone else. And where I can see where we've gotten a little bit of disharmony in the vet space is that we do have people making decisions for the vet industry, for the clinics, that aren't in touch with the reality of what's going on in the clinics. So there's this disparity between decisions that are getting made and actually things that are going to be real value adds to the clinic performance. And so it takes a balance. Actually, we do need people with business acumen, right? Like, so, and the dollars coming into the vet industry, those are all good things, right? But it needs to be balanced with like actually knowing what goes on in the actual individual practice so that you can make healthy decisions that are in line with a sustainable vet industry.
Yeah, perfectly said. I absolutely agree with you. I'm wondering what you have on your list of things in the future, like hopes or goals that you're setting for Booster Pet.
Yeah, I mean, we're now expanding. We just did our first acquisition, which was super fun. Looking for smaller practices that, are 20, 25 years old, where we have some veterinarians that are looking maybe retire in the upcoming 5 years or so and implement our model into existing GP practices to gain efficiencies there. So that's been fun. I think so far we're proving that we can gain the efficiency of a GP practice about 10% of their margin, but we're playing, maybe we can get a little bit more than that. There's been some legislative opportunities that would mean we could play a little bit more with the model in some states. So we're looking at states such as Arizona for potential next expansions. But yeah, we want to grow the model, and mainly because we want to spread the love. We want to show people that, hey, this is a sustainable way of practicing, and that we can do better in the space, and we can kind of unleash that passion and that talent that we have with our veterinarians and our vet techs, make better clinics, and also have that work-life balance. Like they're not exclusive of each other, right? We can make clinics more profitable and people can be happier. Like,
yes, finally,
right? It doesn't have to be either or, right?
It does.
And that we need to really focus on sustainable models for growth rather than people just trying to squeeze the existing lemon to make some more lemonade.
I think that's the core takeaway of this entire podcast, really, is Booster Pet is a way of building sustainable systems where you can have your cake and eat it too. You can have a profitable, well-oiled machine of a business where people also thrive and are healthy and have that, a taboo word, work-life balance.
Right. I mean, exactly. Yep. I mean, it went back to that. I mean, that's the exact why we exist in the first place is, why are we fighting this kind of war in the industry where people feel, undervalued, underpaid, they're working too much. Like, isn't there a way that we can move forward where people can love their jobs again, be respected, feel fulfilled in their jobs, and have room for other parts of their life? Because if we can get that balance back, and I think Booster Pet, has a solution for that. And I hope other people are working on other solutions too, right? But that sustainability is what's going to guide our trajectory as an industry in the future, right? So we can't have a staffing shortage and then in a service industry and not be able to retain the staff that you have. So like step one, like how do you create a system where actually people want to work with you, right? Like that's like, it's not that hard, right? Like, let's just get back to basics here. I always like to say there's a lot of low hanging fruit in the vet space. And our job is just to the first thing is just, make a fruit salad, pick up all that fruit and make something good with it. Right. And then we can get on to more progressive, harder problems to solve.
Well, you've done a wonderful job making the fruit salad there. I'm a big fan of your model. When I learned about it, I was very impressed. And there's just something about innovative ideas and just testing them out. You start with one clinic or one mobile unit, and then you see how it goes. And then here you are time's gone by, you got through COVID, and now you have five clinics, and you had your first acquisition, you're looking to expand possibly into other states. So the proof is in the pudding, right? It's working what you're doing. Your clients like it, your patients are well, and your staff are happy. So you're doing something right. And I'm really proud of the work that you've done.
Oh, thank you. We're super, super, super proud of it, and we're eager to keep improving. Right? It's a work in progress.
Yes, absolutely. So I'm imagining some people listening today might be interested in learning more about you, connecting. Where's the best place for them to find you?
Yeah, I mean, everyone's welcome to email me directly. It's katie.cutter@boosterpet.com. I have a cell phone number. I'm 706-206-1005. I'm not shy. So yeah, we also have a website and that has a contact information. It's just boosterpet.com.
Great. I will link all that up in the show notes. And I guess I found you on LinkedIn too. So
there you go.
That's another way to meet. So yeah, and absolutely reach out. So for those people, I'm imagining if you guys are looking to expand and you're looking for more technical staff or doctors that are interested in this more flexible approach, or even are you still looking to acquire hospitals in the Seattle region?
Yeah, we're looking in Seattle and we're looking in other markets as well. So yeah, for sure. We're always looking for partners who believe in our mission, and it's kind of like, when you're ready to retire or thinking about retiring, want to leave your hospital and into the hands of someone who can value the legacy and the staff that you have.
Yeah.
There. So that's it. That's one of the things that we're all about. Yeah. So if you're looking to sell, for sure, I'll be just looking for ways that you can leverage your staff more effectively, or other ideas. I'm always happy to collaborate with people.
Okay, wonderful. I encourage everybody to reach out if you have any questions. Dr. Katie, I've really enjoyed having you on today, and thank you for spending the time with me.
Well, thank you. I've really enjoyed it.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.